Hi, everyone. This is Dr. Beebe, and I just wanted to go over chapter 3 with you that looks at different types of diseases. It's important that we are all on the same page as far as understanding these different types, these different sources, modes of disease transmission, to move on to later chapters. Okay. All right. So once again, what is disease? When we're talking about disease, especially when you're looking at something like anatomy and physiology, human biology, we define a disease state as being out of homeostasis. Okay, so it's an interruption, a cessation, or disorder of body functions, systems, or organs. So we can talk about communicable and non-communicable diseases. Okay. If an infectious disease is contagious or capable of being transmitted, it's called a communicable disease. So we've been talking a lot about COVID since it's in recent memory. COVID is a great example of a communicable disease that can be transmitted and is contagious. Flu is another example of that, the common cold. Non-communicable diseases are then the exact opposite. These are ones that are not transmittable. So heart disease. We talked a little bit in last chapter about, or the first chapter about injuries from accidents, mental illness. These types of disorders or conditions are non-communicable. They're non-infectious. Causes of diseases. It's very important for us to identify the causes of disease so that we can try to prevent these. We talked in chapter 2 about the individuals that had that healthy curiosity and kind of built the foundation of epidemiology. And, that still remains our primary focus in epi. And then, of course, we need to know how it's being transmitted, because if we don't know how it's being transmitted and how it's being spread through the population, then we don't know what we can do to prevent or to contain this disorder. So there are two general types of disease transmission. We have vertical and horizontal transmission, okay? Vertical is something that's passing from an individual to its offspring. Okay, so it's passing via sperm, through the placenta, through the milk, versus horizontal, in which we're looking at the transmission of infectious agents from one infected individual to another susceptible individual. And we talked about the importance of susceptibility in a previous chapter. The organisms or substances that we're talking about as far as being the cause or capable of producing diseases can be bacterium, they can be viruses, which are non-living components that have to rely on our cell machinery to replicate and to cause infection. Maybe it's fungi, parasites, but those are the pathogens that we're talking about. When we talk about infectivity, we're talking about the ability of a disease agent to enter, survive in, and multiply in a susceptible host. Okay, so they need to be able to enter, but they also need to be able to multiply within that susceptible host to cause an infectious state. Okay, their ability to get into a susceptible host is termed invasiveness. So whether that's in through a mucous membrane in an individual, whether it's in through respiratory membrane, something that you inhale in, maybe it's a breach in your skin, you have a cut. So that opens up that protective nature of the skin and allows a pathogen to enter. The strength of a pathogen or the ability to cause disease is called its virulence. And then viability is the capability or the capacity of the pathogen to survive outside of the host and to exist or thrive in the environment. And then lastly, we have toxins, which kill pathogens by poisoning them. Antibiotics are toxins, okay? They are toxic to the pathogens that they are designed to fight. So then we can look at whether diseases are acute or chronic. Acute disorders usually have a sudden onset, they're relatively severe, but we're looking at a shorter duration of symptoms, a shorter duration of disease state, versus chronic, which tend to be less severe, but have long or continuous duration. And some of these long periods can actually be a lifetime for certain disorders. So these are some questions that you can think of. So are all infectious diseases communicable, right? What is an example of a chronic communicable disease? And what are examples of infectious diseases that are chronic? Okay. So here are answers to those questions. This is examples of these diseases that we were just asking questions about on the last page. So example of infectious diseases, acute versus chronic. Tuberculosis is a great example of a chronic infectious communicable disease. Okay, it's something that can be transferred from individual to individual, but tends to be very long lasting, okay, versus measles, in which this is a very rapid onset, tends to be more severe in symptoms, but is still infectious. It still can be transmitted to another individual, okay? But we also have non-communicable infectious diseases, okay? So example of those are anthrax, tetanus, Legionnaire's disease. Okay, these are acute, non-communicable infectious diseases. So yes, they do exist. And then we have non-infectious, acute or chronic disorders. Okay, so non-infectious, we're looking at suicide, accidents, okay, strokes. All right, these are acute. These are fast-acting, abrupt onset versus chronic non-infectious, non-communicable disorders such as arthritis, diabetes mellitus, okay, alcoholism. So what are the major stages in the disease process? We have susceptibility, okay. We have pre-symptomatic diseases, all right. So we have an incubation period and a latent period. Then we have the stage of clinical disease and then the stage of recovery, disability, or death. Okay, so where the individual is either going to recover fully, they're going to have some lasting impacts as a disability or death. So when we talk about disability, it's a very big term that talks about kind of those impairments or limitations or restrictions that are a result of one of these disorders. Okay, so an impairment is defined as any loss or abnormality of psychological, physiologic, or anatomic structure or function. Activity limitations are difficulties that individuals may have executing certain activities. And participation restrictions are problems that an individual may experience in involvement in life situations. So if we're looking at the natural history of communicable diseases, okay, this is looking at time. So if we have these stages, remember the stages are the susceptible host. So the susceptible host has the point of exposure. Now remember, they have to be susceptible. It has to be a disorder that this individual can actually get. All right. Then we have the subclinical disease stage. So this is where we've started the pathological process. So the organism, the pathogen, has probably invaded the body and is starting to replicate or work within, if it's a virus, taking over the machinery of the host. Okay. And then we have the onset of symptoms. Once we have the onset of symptoms, then we've entered the clinical disease stage. The first part of that obviously will to gain a diagnosis, and then hospitalization if necessary, and then we move on to the stage of recovery, disability, or death. This is a great example that you can look over, example of zoonosis, looking at the transfer or the life cycle of that disorder. Viability is the capacity of the pathogen or the agent to survive outside the host and to exist or thrive in the environment. And this is important because this tells us, how long this pathogen can survive and how long that we may be susceptible to this pathogen. Okay, so if we know the guinea worm has a viability of 1 year, then we know that we have to actually break the cycle for 1 year to get rid of this pathogen in an area. Here is a great example of the guinea worm. This is a link that you can select. So what are the categories of disease, these main categories of disease? So we can look at congenital versus hereditary, allergies and inflammatory diseases, degenerative diseases, metabolic diseases, and cancer. So congenital and hereditary diseases are ones that you are born with, okay? So these are inborn abnormalities where there's been an injury to the embryo or fetus by certain environmental factors, okay? When we talk about allergies or inflammatory diseases, this is basically where the body is reacting to an invasion or a foreign object or substance. Okay, so arthritis is an inflammatory disease. Degenerative diseases are diseases that act in a deterioration of different body systems, tissues, and functions. Metabolic diseases are when we have a limited function or a malfunction of certain organs, or physiological processes within the body that lead to disease states. Okay, diabetes is an example of this. And then cancer. There are many different types of cancers. These are characterized by abnormal growths. These growths come in the form of tumors, whether benign or malignant. Basically, what happens is the growth switch, if you will, is broken, so we have this uncontrollable growth. So how do they gain entry? Okay, so we talked about the fact that pathogens have to be able to gain entry to cause disease or disorder. This can be through respiratory membranes, through the nasal respiratory membranes. This could be through mucous membranes in the oral cavity, reproductive, might be through the urinary system. Obviously, if we have a breach in the skin, that can be another way that we can have entry into the human body. And then also another example is from the mother to the embryo. So the incubation period is the time between inoculation, okay, so between the time of entry and the appearance of first signs or symptoms. Okay, so that's the incubation period. So once it's entered your body or the susceptible host, How long does it take to see those first signs or symptoms? Okay. And that's important for us to know because sometimes with some of these infections or some of these diseases, the individual might be infectious prior to us seeing those signs or symptoms. So then when we look at the later stages of infection, okay, and then zoonosis, right? Once again, and these are disorders or diseases that travel from animals to individuals, okay? So this is that infectious organism. It can be transmitted to humans, excuse me, through direct contact or a fomite. Remember, fomite is an inanimate object or a vector. This is a table in your book that lists some common, well, not common, but some examples of zoonosis. The World Health Organization has a method or has a tool for international classification of diseases. And basically, it's to make certain that everyone is talking in the same language. Okay. So it allows us to compare data or statistics on collection, classification, and presentation um, in an international arena. Notifiable diseases are those that are considered to have public health importance because of their seriousness. These are also ones that have a high potential to spread, very serious morbidity or death rates, and can be controlled with appropriate intervention. Okay, so rabies is a great example of a notifiable disease. When we talk about infectious diseases, we often talk about immunizations. Uh, According to the CDC, if fewer than 80% of the children in an area have been inoculated for a contagious disease, the danger of outbreaks or epidemics remains very high. Okay, so here we're talking about herd immunity. The idea that we want to have immunization rates greater than 80% so that the individuals who maybe can't get vaccinated for a physiological reason, maybe they're allergic to some component within the vaccine, or they have other conditions that prohibit them from getting these vaccines, that if we have this higher than 80% vaccination rate, those individuals still have some slight coverage or some protection by this idea of many people in the community being covered. So if we have many of the people being covered and not being able to be infected because of the vaccines, we have less people to transmit that infectious disease. So what are other types of immunity? Okay. Active immunity is one in which the body produces its own antibodies, right? So this can be either through a vaccine where you get a vaccine that has a non-virulent form of the pathogen. So what it does is it ignites your own natural immune system to create agents to fight that agent or that pathogen. Okay, so that's an example of active immunity. Passive immunity is when we're talking about the transplacental transfer. So the mother's immunity to diseases is being transferred to the unborn child. That's one of the very large benefits of breastfeeding. This is the table from your book showing some of the diseases for which we have vaccines. Herd immunity, I mentioned that a minute ago, but it's the whole idea of that that the crowd or the protective nature of the group. Okay, the whole idea that if a population or at least 80% of those individuals have immunity, then the chance of a major epidemic occurring is highly limited. So that's the idea of herd immunity. And that's one of the dangers with people deciding to forego vaccinations without a significant reason, because they put the whole population, including their own children, at risk. When we talk about the emphasis of epidemiology, okay, the whole idea of prevention, okay, we've seen a slight change in our emphasis, and that's because we are no longer a population that is dying mostly from infectious diseases because we've had so many advances. Instead, we are living our longer lives and having more chronic diseases, more chronic non-infectious diseases. So cardiovascular disease, cancer, those sort of disorders versus dying from these infectious diseases such as influenza. Okay, so because of this increased life expectancy and because of this kind of shift from infectious diseases to chronic diseases, we are seeing kind of the same change in emphasis in epidemiology. So, what are some ways that we can lead prevention? Okay. One of the ways that we saw frequently in the COVID epidemic was isolation. Okay. You were recommended to stay home if you were testing positive for COVID. Okay. Now, obviously, those isolation requirements have since lifted, but that was something that we saw, and that's very important when we're looking at that infectious disease control. Quarantine is something that we apply to people who've been exposed to the disease, but may or may not become ill. So if we're looking at a disease that has a long incubation period, we might be looking at quarantining those individuals until we find out if they actually do become ill. So if we have an incubation period of 20 days, they might have to be quarantined for those 20 days to make certain that we're not seeing the onset of disease. So that covers Chapter 3. Once again, if you have any questions or concerns, please let me know. Uh, and I'll be covering Chapter 4. Thank you.